Good afternoon. As of noontime today, Prince Edward Island still has a total of 26 cases of COVID-19, 24 of which are recovered. There are no new positive cases. We received 98 new negative tests since yesterday. And of course, this is in stark contrast to the more than 2.74 million cases of COVID-19 around the world and more than 184,000 deaths. Across our own country here, more than 42,000 cases and more than 2,100 deaths. On a more positive note, the doubling of our cases in this country has gone from every 5 to 8 days from end of March to middle of April, and now it's been more than 10 days since we've seen the number of cases double in this country. As we head into another weekend, it's important that we are very clear on public health measures that are still very much in place. We continue in a state of emergency and a public health state of emergency. And we are working very hard on a cautious plan for reopening P.E.I. together, outlining exactly what will be easing back restrictions will look like in gradual phases here in P.E.I. And we've talked about it earlier this week, and we'll continue to talk about it, but it will be laid out more publicly in detail next week. But I do need to be clear that at this point in time, restrictions have not changed, and we're looking ahead to when we will be easing up some of these public health measures. For now, we need to keep doing what we're doing so that we can be in a comfortable place, more comfortable place as we start that process of easing up. If you have traveled outside of our province anywhere, you are to self-isolate for 14 days, and this means staying in your own house or in your own property at all times. And essential workers traveling into the province also need to self-isolate when they're not working. We have currently 1,714 individuals who are self-isolating in P.E.I. And I would like to thank all the people who are making daily calls to these individuals and helping keep all of us protected. To note, 1,007 individuals have completed their 14-day period of self-isolation since these measures came into place, or the follow-up calls started. If you are not under self-isolation and need to go out for essential reasons, you must continue to practice physical distancing. And physical distancing or social distancing, the terms are so much more familiar now than they were 2 months ago, of course. This means staying 6 feet or 2 meters away from each other. And of course, in addition to this, it is really important to practice the things we always talk about, the good hand washing, coughing into your sleeve, etc. I know there were questions yesterday around the 5-person rule for gatherings. And at this point, to keep it simple, Islanders should not be gathering with anyone they do not live with. And I realize there are exceptions. I mean, if you were in a lineup at the grocery store, keeping physical distance, you get what you need and then you go home. This is difficult. And it's hard for everyone. And we hope to really ease up and lighten up on these restrictions soon. And we'll be able to speak about some of that in more detail next week. But at this point in time, it's important that we've worked really hard to make sure P.E.I. is in this particular position. Large mass gatherings for events, I can very clearly say, will not be part of any early phase of a reopen P.E.I. together plan. And the only way we can get back to a point of easing these restrictions is to continue to follow them carefully, and then as we ease up to ease up gradually. And finding loopholes and ignoring public health measures puts all of us at a risk of spreading COVID-19 in our province, and extending the time that the restrictions we have now are current, the time that the restrictions are in place. Anyone traveling to Prince Edward Island should do so for essential reasons only. We know that P.E.I. is a beautiful place, and many people travel here, especially as the weather starts to change and in the summer months. And some come because they want to go to cottages and summer homes. But for the next month at least, this is not the time to visit. It is really important that we have tight border control, especially as we look ahead to consider what restrictions we may be able to ease off within our province. I know our job in the Chief Public Health Office and my responsibility is to try to protect the health of all islanders, and our border measures are a big part of that. Updated testing information has been added to our website, and of course our approach to testing continues to evolve with the changing COVID-19 situation, and we'll be reviewing our guidelines very regularly and at least on a weekly basis. I mentioned the testing for COVID-19 for the following individuals, and I'll reference them again today. Testing for the general public, anyone with symptoms or anyone who has been a close contact of a confirmed case. Hospitalized individuals with influenza-like illness admitted to hospital or admitted to intensive care with respiratory symptoms. Healthcare workers, and that's any healthcare worker experiencing symptoms or who travel back to P.E.I. or have traveled out of province. Long-term care residents and staff, new residents who are being admitted, any resident with symptoms, and all staff and residents who are close contacts of a case. And we are operationalizing through Health P.E.I. staff who work in more than one long-term care facility. Also, patients transferring between healthcare facilities and temporary foreign workers and non-essential workers who travel outside of P.E.I., and we are trying to operationalize that aspect as well. So if you experience any COVID-19 symptoms, and I know Marion mentioned this yesterday, new onset of fever, a new or worsening cough, sore throat, runny nose, sneezing, congestion, or unusual fatigue, you should please call your family physician or nurse practitioner, and they can refer you. Or if you do not have a family doctor or nurse practitioner or unable to reach them, please call 811. I've said this before, it is a sprint. It's not a sprint. It's definitely a marathon. And we have been doing so well here in P.E.I. And the finish line is still not in sight yet. But we continue to continue the race. We have to keep going. And I know we're all eager to get back to the way things were. But it is crucial that we do things gradually, carefully and cautiously to get this right. Someone just said to me on the phone, there's nowhere I would rather be in the world but in P.E.I. right now in this pandemic, and I agree with them. I think we're very fortunate, and we just have to be careful as we go forward. Thank you and enjoy the weekend. Je vais faire quand même un peu en français et je vais faire, je n'ai pas des notes en français, alors je vais faire vraiment de ma tête. Bonjour, on n'a pas de nouveaux cas de COVID-19 ici à l'île du Prince-Édouard aujourd'hui. On a encore 26 cas confirmés. Depuis hier, on a eu 98 résultats négatifs. Mais partout au pays, on a plus de 42 000 cas et plus de 2 000 morts. C'est important c'est près le week-end, qu'on réalise que les mesures de santé publique sont encore en place. Et on est en train de travailler sur les détails d'un plan, de relâcher les mesures, mais on n'est pas encore là. Mais alors c'est important de continuer comme on est au moment. J'ai mentionné en anglais aussi qu'on a au présent 1714 individus qui sont en train de auto-isoler et puis on fait les appels à ces individus et remercier aux gens qui font les deux, qui s'auto-isolent, mais aussi les personnes qui font les appels. À ce moment, c'est encore important être ensemble seulement avec les membres les personnes qui habitent avec vous à la maison. Mais j'espère la semaine prochaine, on va parler que ça va changer un peu parce que je sais qu'on est tous hâte d'avoir plus de chances d'avoir une occasion de visiter avec d'autres personnes. Mais les événements qui vont avoir beaucoup de gens, on n'a pas, ça va pas changer dans les prochaines semaines. Chaque fois que je remercie les insulaires de tout ce qu'ils font ici. Pour qu'on ait une place, on est chanceux, mais on a travaillé fort d'être ici et on doit continuer. Merci. And I'll turn it over to you, Mary.
Thank you, and good afternoon, everyone. As I mentioned yesterday, we continue to evaluate and plan for the return of some services across Health P.E.I. in the coming weeks. We need to do this safely, balancing the need to provide ongoing essential services, maintaining capacity and supplies for any possible COVID-19 surge in patients, as well as beginning to provide services that have been put on hold that may safely be done now because patients have been waiting. Risk assessments on any health services to be reintroduced will be done by Health P.E.I. clinical and operational leadership and with input and direction from the Chief Public Health Office. We do also continue to have a real focus on resident safety in our long-term care homes to ensure the safest protocols and practices are in place. We do continue to offer the cough and fever clinics 7 days a week and the drive-through testing in both Charlottetown and Summerside. Yesterday we saw 64 patients in Charlottetown and 17 at our Summerside clinic. I want to just remind Islanders to please seek help if you have health concerns. We do still offer essential services, and that means that many of our programs are still available. If you've not been notified that an appointment you had booked was canceled, please call ahead to ensure it's still on. And if you have an appointment, please attend and receive the care that you need. These services are being provided because they are important to maintain the health of Islanders. We want to ensure that while we respond to COVID-19, Islanders stay otherwise healthy. We don't want to see increase in health issues unrelated to the coronavirus, but may indirectly happen as a result of this pandemic. Our hospitals and health services are safe, and we are there for you. I also want to remind you again that any emergency or urgency care and other essential services are available, and please call 911 or visit an emergency department if you are in need. Thank you.
Thank you, Marion. And open for questions.
Tony Davis, PBC.
Hi, this one's for Marion Dowling. So with the hospitals cut down to essential services, has there been any consideration given in reallocating that staff to help deliver community care services such as home care?
Hi. Yes, there have been some of the staff, particularly in our ambulatory care services and other areas, and that have been redeployed or reassigned to other areas of the system. And the moving to essential services within community and not offering some of our group programming and other pieces of work have also allowed that staff to then be offering the additional services of the screening clinics and the assessment and testing sites. At the beginning, within the acute care sector, the beginning of our response, we had redeployed a number of staff from within the hospital to do training and additional preparedness for the surge in patients and preparing additional intensive care spaces and moving of patients and services. So those staff, although the occupancy rate has been lower to create that capacity, have been doing other work and training and preparation as part of the response.
Okay, thank you. And at what point are home care workers being provided personal protective equipment to deal with patients? And what would that PPE consist of? Would they get masks, face shields, gloves, and gowns?
Yes, they would get all the necessary personal protective equipment, and they would have had that in an ongoing way when they've had to go into homes which may have had other types of outbreaks. And I know they've seen clients with different sort of protections that they've need to put in place, as well as seeing influenza clients in the past. So home care staff do have some of this available to them, and they do what we refer to as a point-of-care risk assessment. So they screen their clients based on their travel history, whether they've been traveling from out of province. If they are home self-isolating and are requiring this service, then they would use the necessary PPE to go and see those clients or be able to reschedule some of those services or do things virtually.
Okay, thank you.
You're welcome.
Nicole Williams, CBC.
Hi there. Both my questions are for Dr. Morrison. You mentioned recreational fishing is one of those things you're doing risk assessments for right now. I'm wondering what other risk assessments you're currently doing or plan to be doing ahead of May 1st.
Hi, Nicole. So when I mentioned the working on the detailed plan for that will have available next week, and I know the Premier will be involved. Some of those will be more clear. So there'll be activities. We've talked about them. That mainly outdoor activities. Outdoor recreational activities in part of the first phase, and the importance of doing that gradually. And some of the areas will be through risk assessment and looking at and then providing guidance. So some will be much more having to do a consultation process, and we've heard already from some, and some will be more just not just, but guidance, and it means that not everyone will have to submit in the same way for risk assessment. So I think you'll certainly see a lot more, and I think everyone's getting that sense of wanting to start. If we don't have more cases and we're keeping things tight at the borders and our entry points, I think people have that sense of wanting to start this journey to easing up some of the public health measures. So recreational fishing, it was one I mentioned last week, and certainly had gotten a number of questions about that one, and some of them will be about. There's such a range; it's hard to pick one, Nicole. But we're looking at a large range, and we'll have them all listed out in much more detail. And I think I'm sure people can almost anticipate what some of them will be, but they'll start small. Our orders will not have changed in terms of gatherings, but we're hoping it will allow people to do a little bit more than they have been doing now.
Thank you. And, I know that you've talked about giving people hope as well. And, one of those the biggest things people want to do is visit friends and family. And I know you get asked this a lot, but we know that today New Brunswick said people might be able to be closer with each other in the third phase. They were a little more specific. I'm wondering if you could be any more specific about what phase visiting some friends and family might fall under.
We are literally having some of those same discussions with the public health team this morning. Well, not just this morning, for many days, but up to and including this morning. And that will all be very much a part of that release that we're talking about next week, and trying to give some dates, recognizing that the phases and the dates associated with these early parts of the phase would change drastically if things change in the province. And so we go through this trying to really minimize the risk, and recognizing that and I think New Brunswick are feeling very much the same way. They're in a similar position with low numbers per population, 100,000. And so I think, Nicole, they're exactly the questions I know people are wanting to know. We are in such a fortunate position that we're able to talk about ease back a little bit earlier, and trying to do some of that initial ease back by the 1st of May. And you're right. I think we all need to hope that it goes well, and there is definitely hope that we will get to have some more contact with each other. And we all want it. I want it. We all do.
Thank you.
Stu Neepy, The Guardian.
Hi, happy Friday to you both.
Hi, Stu.
I suppose this question would be for Dr. Morrison, but if Ms. Dowling, you have any thoughts on it, would love to hear those. Of course, I'm going to ask about testing again. So the last week ending Monday, it looks like P.E.I. basically conducted about 150 fewer tests than the first week of April. So, I mean, all this week we've been hearing about the importance of increasing rates of testing, more population testing. So I guess what I'm wondering is, going forward into May, when we're easing back restrictions, do we plan to sort of ramp up the number of tests we're doing each week, each day? And which populations do we move into? Like, are we moving into asymptomatic people at borders? Again, are we focusing on long-term care homes? Like, where do we ramp up the testing going forward?
Stu, and I'm not sure if you were able to be on the call yesterday or not, but that's exactly what we're talking about. So now, we've able to do 2,000 tests a week, and we have that capacity, and we announced a number of new groups that would be at times asymptomatic as well. So those are exactly why we're trying to reach out, recognizing we have capacity so that we do more tests. So not just people who are symptomatic, but testing people who are healthcare workers, because they're a risk if they're moving between facilities. And they don't have to have symptoms. We want to test them not just once, we want to test them regularly going forward. The same thing with identifying and trying to operationalize some of those high-risk essential workers coming to Prince Edward Island. They don't need to have symptoms. We're going to continue to test them and want to test them regularly. Those are really two groups that we're fortunate, very fortunate in P.E.I. to have that capacity to do this at this time. And so that we are actually trying to get more people tested and focusing on certain risk groups, and then we'll continue to evaluate that every week going forward. And so absolutely, I think some of the fewer testing numbers that we did last week actually were because there aren't as many people who are having other viral illnesses with cough and fever. So I think the numbers that we're seeing at the clinic were down last week, but that's why we just keep emphasizing every day in my message, and I know in Marion's, that anyone with symptoms, but it's not just those. We're going to be testing the temporary foreign workers into the province. testing people on admission. Again, these people do not have symptoms, but we think it's really important to continue to test them. And for instance, people on admission into long-term care facilities without symptoms, they won't just get tested once on admission, they'll be tested a few days later as well. So again, really trying to continue to test people. We want to test more people and continue to do so.
Okay, thank you for that. I guess as a follow-up about the device that you mentioned yesterday, the Kingfisher machine on loan from ABC. Just wondering why was it yesterday, I guess, that this was announced as opposed to earlier? I mean, does it have anything to do, like the fact that we're using this machine, does it have anything to do with the procurement of supplies like reagents, like the contracts that have been signed by the Public Health Agency of Canada?
I don't believe so, Stu. I certainly wasn't made aware of that being part of the issue, or not part of the discussion. I think it was a discussion with the Atlantic Vet College and CFIA with Dr. German in the lab, and I believe you will be speaking to Dr. German, or I believe that's the plan. And so I'm sure you can follow up with him for further details on that.
Okay, thanks so much.
Great, thanks.
Laurent, la voix est Acadienne.
Bonjour, Dr Morrison. D'après ce que vous avez dit, je comprends que le déconfinement, il va avoir 3 grands principes qui sont les tests, la frontière qui reste fermée et l'éloignement physique qui va se poursuivre. Est-ce que c'est bien ça, les 3 grands principes à partir du 1er mai?
Bonjour Laurent. Vraiment, la frontière, c'est important comme vraiment sur un côté. Les tests vraiment au milieu et la distance physique. Et aussi, après qu'on annonce un plan, c'est aussi d'avoir notre officiaux de santé publique qui vont répondre aux des complaints ou s'il y a un problème, et puis ils vont aussi aider à inspecter comme un resto comme il fait maintenant, mais c'est à propos si il peut fonctionner dans une façon qui est en sécurité pour la public. Alors, c'est l'autre chose. C'est les 3 que vous avez mentionnés, mais encore, il faut avoir un renforcement et sur l'autre côté aussi.
D'accord. Donc, ce que vous dites, c'est que, par exemple, les restaurants pourraient éventuellement rouvrir si ils peuvent maintenir l'éloignement physique entre les clients, c'est bien ça?
C'est pas sur une des phases, des étapes en premier, mais ça va être plus détaillé la semaine prochaine dans le plan. Mais à un moment donné, ça va peut-être fonctionner avec un certain nombre de gens au resto, par exemple. Mais notre officiaux vont pas seulement aider avec les restos, c'est les autres business. Et puis si quelqu'un pense que ça ne va pas quelque part, même une organisation fonctionne pas comme il faut, ils vont aider à régler.
Merci.
OK, merci.
François, Radio-Canada.
Bonjour, Dr. Morrison. Vous avez mentionné 1700 personnes, plus de 1700 personnes qui sont en isolement et auprès desquelles on fait des vérifications régulières. Quelle sorte de pression ça met sur votre service? Quel nombre de ressources ça prend pour être en mesure de faire des suivis aussi réguliers et serrés avec ces personnes?
Bonjour, François. Ça prend assez grand nombre de personnes. Je pense qu'il y en a 15 ou 20 depuis le début, et puis ils travaillent 7 jours par semaine. Mais on est en train de chercher des autres pour qu'on peut donner des jours de congé aux gens. Alors, mais c'est une équipe vraiment, il s'appelle, il sait qu'il travaille sur Operation Isolation, et puis il sait qu'ils font quelque chose pour aider les insulaires, pour tout le monde, et puis ils donnent le support aux personnes qui sont en train de s'auto-isoler. Alors, ils sont une équipe qui a beaucoup d'énergie, vraiment, pour qu'est-ce qu'ils font chaque jour. Mais c'est un peu de travail, bien sûr.
Et une fois que cette pandémie va être terminée, une fois qu'il y aura moins de personnes qui vont être en isolement, quelles tâches vont faire ces 15 à 20 personnes qui travaillent pour faire des suivis comme ça?
C'est les personnes qu'on a maintenant qui travaillent normalement pour d'autres parties du gouvernement. Et à ce moment, ils ne travaillent travaillent dans leur propre département, alors ils travaillent avec nous. Alors, ça va changer quand on commence à retourner au travail dans les semaines qui suivent. Alors, pour cette raison, on cherche d'autres personnes aussi.
Merci.
Okay, merci. I'll just translate those last couple of questions. One from Laurent was about what are the big areas of focus as we go forward in terms of easing up? And really, we talked about the strict border control, the tests, which are really focused here in Prince Edward Island, so we know what is going on. And then, of course, physical distancing being a key part of it that he mentioned. And then the other part being on the other end of it, trying to make sure we have good inspections to make sure that as we ease up and things open up, they do so protecting the staff and the public. And there'll be increased inspections and follow-up of complaints from that regard as well. And the other question was about how many people we have trying to make those calls to the 1,700 plus people who are self-isolating. And right now we have people who are this enthusiastic group of callers who really are taking this seriously, and I thank them because they're helping everybody. And they're offering support to the people who are having to self-isolate, as well as protecting islanders. So they have come to us from other government departments, and we are looking at trying to get other people on board so that they can have a day off. So that will continue to be a process as we go forward. Thank you very much.